Okay, let us continue with our sodium. Okay, we ended here with the sodium hydroxide class. So we discussed last time that sodium hydroxide is used as a saponifying agent. When you say saponifying agent, we use that as a basic or an alkaline material to produce soap. So when we make soap, we just need oil or like fats, dependent na on what is available, but oil or fats can be used. And then we will add the sodium hydroxide to it. And then after that, soap will be formed. You will see that the fats or the oil will solidify, and that's what we use as soap. But it is not just sodium hydroxide, ha. We can also use other alkaline substances. It's just that when we want to make hard soap, the one that we use nowadays, for example, yung bar soap na ginagamit natin na hard, that is produced using sodium hydroxide. Okay, so we have here the following examples of products natin class na ginamitan ng sodium hydroxide. So we have here sodium hydroxide plus vegetable oil, how we will produce a hard soap or a bar soap. Like the sodium hydroxide, pwede din naman potassium hydroxide tapos olive oil ang ginamit. We will have the Castile soap, but I'm not really familiar with this. I have not seen this one in the market. What I am familiar with is the Perla and the Palmolive. Now take note of this, when we use Perla, we have sodium hydroxide or potassium hydroxide. We can use the two. And then what oil is used for that? It's the coconut oil. And then, ayun na, that's the Perla na ginagamit natin maglaba. However, we have here, we have these two, either of the two, ha. And then palm oil plus olive oil, we have the Palmolive. So that is the reason why it is called Palmolive, because it's a combination of the palm oil and the olive oil, and then reacted to a basic material. Now again, it can be sodium hydroxide or potassium hydroxide. So again, the process is called saponification. So again, let us summarize this one. A basic substance or an alkaline substance plus an oil or a fat, pero let's just call it long chain fatty acids. They are fatty acids though. We will get soap, and actually we have another product here, the glycerol. If ever you are asked, aside from the soap, you can also get glycerol there. But syempre, what we use in our day-to-day lives is yung ating soap. The process is called saponification. Okay? Now, another, wait lang ha. Bakit? Ayan. Another compound for our sodium is the soda lime. We have here, other name for our soda lime is calc soda. Ginagamit naman ito as a carbon dioxide absorber, especially for patients under anesthesia. When you say under anesthesia, example, during operation, the patient is given a general anesthetic that is inhaled. Now, kapag there is presence kasi of gas, a lot of the anesthesia will be wasted. So for it to para ma-inhale ulit yung mga anesthetics, and then we can have the optimum dose, no, ina-absorb yung carbon dioxide so as not to interfere with the inhalation of our general anesthetic. Yan yung gamit ni soda lime. But soda lime is not actually a single compound. It's a mixture of calcium hydroxide and sodium hydroxide. That's the name, soda lime. Soda is referring to the sodium hydroxide, and the lime is the calcium hydroxide. So it's again a combination, ginagamit as a carbon dioxide absorber para ma-optimize yung gamit ng anesthetics. Next, we have the sodium hypochlorite. So you can write it as an AOCl or an AClO. Ang dapat nyo tandaan with the sodium hypochlorite, ginagamit siya as disinfectant. Most likely it's disinfectant or bleaching agent. And this is the component of our Clorox or yung tinatawag natin na Zonrox, though it's a brand. So like if you are asked what is in the Zonrox or the Clorox that makes it a disinfectant or a bleaching agent, it's the sodium hypochlorite. Other name of that is the Dakin solution. Now take note ha, it is only a disinfectant and it is not an antiseptic. So definitely this is not suitable for wounds or any living tissues. Now, aside from that, we can also use this as an oxidizing agent because of the presence of oxygen in the chemical formula. Now, we have here, class, a lot of preparations with sodium hypochlorite. We have here the Dakin's, meron itong I have. The Dakin solution na ginagamit as disinfectant. We can use that one at the concentration of 5% or between 4 to 6%. Again, ano yan? Disinfectant. Especially class in hospitals, yung mga beddings and linens nila na merong blood, ito yung ginagamit nila as a disinfectant sa hospital. The Dakin solution, and it's a dilute sodium hypochlorite solution. We also have the more diluted preparation. We call that the Labarax solution. Okay, but still, we use this one as a disinfectant. We can only use the sodium hypochlorite solution as an antiseptic if class very small yung kanyang concentration. That's 0.45 to 0.5% sodium hypochlorite solution. We call that one modified Dakin's solution. Okay? So like during COVID-19 pandemic, a lot of us used Zonrox, diba? Or the sodium hypochlorite to disinfect areas in our home or anywhere else. But if we want to use this one for tissues, living tissues, or yung mga wounds natin, mag-prepare kayo, gamitin niyo yung like Zonrox kung what is available in there, and tapos i-dilute niyo siya until the concentration becomes 0.45. Kung naubusan, di ba? There was a time na naubusan ng alcohol. Kasi nga, grabe yung usage natin of alcohol sa kasagsagan ng pandemic. Kapag wala na talaga, we can prepare this one, the modified Dakin solution, and use this as antiseptic. Okay? And then another one, the topical solution of the sodium hypochlorite solution is also used as an antiseptic, but it has mas smaller na concentration. So ginagamit talaga siya topically. Meron tayong solution nito as an antiseptic. Panlinis ng living tissues, or if for example you have wounds, you can use that. But syempre, we prioritize the use of other safer na mga antiseptic natin. Okay? Now we have sodium iodide, another compound for our sodium, which we use also as an expectorant. Last time, I think I have mentioned this sa inyo, no? When you say expectorant, anong gamit nito? Anong gamit ng ating expectorant? Para saan siya? Magamit, nakalimot na.
Ang palabas ng plema mo.
Okay, this is used for cough, most especially when we want to expel the phlegm, okay, or release the phlegm. Okay, sa ubo ha, pero we give this if the cough class is productive. So if there is the presence of phlegm Ayan na yon. We want to expel the phlegm. So I have mentioned also that the best expectorant is water vapor, but sodium iodide can also be used. However, we don't have a preparation in the market that is made up of sodium iodide and then used as expectorant. What we have in the market are, we have the, ano nga yung, sakto to, guaifenesin. We have the guaifenesin, the brand name in the market is robitussin. That's what we use as an expectorant. Aside from that, sodium iodide is also used as a solubilizer of iodine. The iodine itself class, the iodine na element or the ion of iodine is not soluble in water. So if you are asked to make a solution from the iodine na solid substance, it will not dissolve. So it will be difficult for us to make a solution if iodine lang talaga ang ilalagay natin. So to help us class sa pag-dissolve ng iodine, we add solubilizers like sodium iodide. What happened here? Wait lang, I don't have my pen. Later na lang. We have here example, the iodine. Remember, iodine is a member of the diatomic molecules, the Birchnow. So that will exist as a diatomic molecule. And then if you add sodium iodide, you will get the triiodide ion. This is negative. I cannot write it na the negative here is a charge sa taas. And then the 3 here is a subscript. Okay? So itong triiodide ion is the one na madaling ma-dissolve sa water. Okay? So instead of the I2, the diatomic molecule of iodine, let's have the triiodide. We call this triiodide ion. This is easily dissolved in water. That's the reason why we add the sodium iodide. And aside from that, sodium iodide is an antifungal agent. Though we don't have sodium iodide preparation in the market, but if you want to use this one as an antifungal agent, it is a good one. Okay, and syempre, if we are going to take sodium iodide, this is also a source of iodine for us, especially for those who have problems in the thyroid gland. Okay, yung may mga hypo or hyperthyroidism. Yes, Lauren.
Bakit yung triiodide, ma'am, is may negative charge po?
Kasi yung ion talaga ni iodine, I remember yung iodine itself, I2 lang talaga siya taman ha, para wala siyang charge. Okay? So, di ba yung mga halogens natin, -1 man talaga yung charge nila. Pero most of them are members of the diatomic molecules, the Birchnow. So when they exist as an element without a charge, they will have two atoms. Kaya naging I2. Na pag dinagdagan mo siya ng isa, hindi na yun magiging balance yung kanyang number of electrons in the molecule. So sobra na siya ng isa. Kaya magkakaroon siya ng charge. It will become an ion. Okay, in this case, we call this triiodide ion. Yeah, the diatomic, the Birchnow, if you can still remember, the Birchnow, bawal ang past is past nito ha, kahit nileson natin yan sa paraling kailangan nasa pala, natandaan niyo pa rin siya kasi kailangan pa rin natin siya sa finals. Okay, so iodine class, sodium iodide is our source of iodine for our thyroid gland. Because remember, if we have deficiency in iodine, it will lead to, for example, goiter. Okay? Yan yung problem natin with our thyroid gland. But actually, iodine is a member of the trace elements inside our body. When you say trace elements, These are the elements that is found in or that are found in our body in small amount only. Small amount lang, but still they are necessary for our cells to function well. Hindi sila pwedeng masyadong marami, di din pwede na masyadong konti. Pero kapag compare natin siya with other elements, si iodine and other trace elements are only present in small amount. Now, what are these elements na present in small amount only? Aside from iodine class, we have the iron, we also have fluoride, the copper, the zinc, chromium, the selenium, and the manganese, or even the molybdenum. Again, they are called trace elements. They are just present in the body in small amount, and they are very important for maintaining health. We call them trace elements or microminerals. Some of them class are present in combination with the enzymes inside our body, or some are important for the functions of our hormones. But then again, small amount only. Hindi pwedeng masyadong marami. They can cause imbalance also. Next, we have the sodium lactate. So para saan si sodium lactate? This is used as a raw material for the regeneration of bicarbonates in our body. Please remember, class, that our bicarbonates function as a buffer in the body. So in the midterms class, we are done with the discussions of buffer. Remember, the buffer maintains the pH of our blood or our body as a whole. Remember, we maintain it at between 7.35 to 7.45. Okay, so we need substances that will resist change or changes in pH if ever merong mga acid or basic substances na pumapasok inside. And our bicarbonates class ay considered as a buffer. So if we want to have a lot of bicarbonates inside the body or to regenerate the supply of bicarbonates inside, our raw material for that is the sodium lactate. Aside from that, it's also used as antacid or anti-acid and a diuretic to increase the urine volume. Okay? Question so far? Daghan kaayo class, basta sodium, daghan jud kay na siya og compounds. And yung compounds nito, iba-iba yung gamit. But yung iba nito, parang antacid and at the same time, diuretic, mostly yung gamit nila. But sodium nitrite is a different thing. Sodium nitrite ha, NaNO2, not NaNO3. Nitrite ito, NO2. We call this one as Philippine salitre. I don't know if you are familiar with the word salitre. If you have worked sa mga palengke or sa market, salitre class is used as a preservative. Okay? Ginagamit ito for curing meats and fish. And again, the purpose is to preserve the meats and the fish. Ito yung nilalagay nila, for example, sa tocino, sa chorizo. And actually, especially kapag naga-red or naga-orange yung meat, talagang sodium nitrite yan ang ginagamit. Okay? But I don't know if they still use this one nowadays because I think the Food and Drug Administration and the Department of Health already banned this one as a preservative because studies showed that it can cause cancer. So Philippine salitre, the sodium nitrite, is a carcinogenic substance, especially to the brain and the gastrointestinal tract. And that is because of the production of the nitrosoamine. Inside the body, the sodium nitrite will be converted to nitrosoamine, and that is the reason why it is carcinogenic. Okay? So you have to make sure na if you consume preserved meats and fish, they don't use sodium nitrite there as preservatives. Kasi again, carcinogenic siya. And inside the body, sodium nitrite is a vasodilator. So it can dilate our blood vessels. And at the same time, it can lower the blood pressure not to some extent. But this kind of preservative is contraindicated to people with migraine headache. Okay, what's the problem with migraine headache? How do you know if it is migraine? Sino dito yung may migraine? Okay, let me ask if you know what migraine is. Let's differentiate migraine from the usual headache. Light and trigger. What else? Walay na yung migraine dire, sana all. Kasi simula high school, I have migraine. Until now, I still have that. So sana all. How do you differentiate headache, the usual one, and migraine? Migraine class is unilateral. What do you mean by unilateral? Isang side lang. Sakit ang ulo mo, tapos isang side lang. Example, the left side only, hindi pantay. Or the right side only, depende sa affected part of your head. Yeah, unilateral, long-lasting, it may even take a lot of days, mostly mga 2 to 7 days. Aabot siya ng 7 days, masakit ang ulo mo. Okay? So, unilateral, starting here, going up, pero isang side lang. So left side sa'yo. Akin actually left side din. Yes, Lolly?
Di ba yung migraine, ma'am, is para siyang sa forehead nagasugod pag nasilawan ka sa
Yeah, pero 1/2 lang ha. It's not the whole head. 1/2 lang talaga. Example, kung left side lang siya. Ano yung kalaban ng migraine? It is triggered by, for example, the light, pwede din sound, pwede din food. So, isa na dyan, class, yung preservative. So, if you have migraine, hindi ka pwedeng, kumain ng a lot of preserved foods. Kasi example here is the salitre, it's a vasodilator. The problem with headache, class, is there is vasodilation in your head. The blood vessel sa ulo mo is dilated, kaya masakit. Kasi during dilation, pain receptors will be stretched. Remember, lalaki yung daanan ng blood. And then the pain receptors found there, especially in the skin part sa ulo mo, will be stretched and maiipit sila, kaya masakit. Okay? Now, sa migraine kasi, there will be aura. Aside from its unilateral, this is unilateral ha, there is also the presence of aura or aura. Before ka mag-migraine, you will really know na you will have one. Ano yung aura na yan? Before sasakit yung ulo mo, may mga indications na minsan, for example, sa akin, I'll have blurry vision or parang may mga lights or like mga stars class na makikita mo. And then that will signify na padulong na ka mag-migraine. Yan yung aura na tinatawag. And wala yan sa usual headache. Walang aura na yan. Okay? Now, what happened there? During the aura, class, there will be vasoconstriction. Especially, this is triggered by light na mag-constrict yung mga blood vessels natin. Liliit yung daanan na blood natin sa ulo. Kaya yung aura na yan. Kaya lang ang problem with migraine, there will be rebound class na vasodilation. So kapag ka-rebound yung vasodilation, mas malaki yan siya sa usual dilation that we have. And that is the reason why mas masakit yung migraine compared to the usual headache. Okay? As in, talagang magta times 2 yung pag-dilate ng mga blood vessels, and that's it. There will be stretching of the pain receptors. Kaya masakit. And remember, our preservatives can cause dilation, just like the sodium nitrite. So please do not consume this one if you have headache. Let's get away from preserved foods like yung mga preserved meats like tocino, chorizo. We can eat that one, pero ayaw po adlaw-adlaw, ha? Lisod po adlaw-adlaw na kay migraine. At the same time, please do not consume preserved meats, especially if nagpula-pula na siya, ha, because of the use of sodium nitrite, because this one is a carcinogenic substance. When you hear the word carcinogenic, it's a substance that can cause cancer. Ha? Aside from that, sodium nitrite is an antidote for cyanide poisoning. Okay? Pag may cyanide poisoning. Example, ano ba yung plant material na may cyanide? You know one? May plant na nagkakos ng cyanide poisoning. What was it? Balanghoy. Yeah. What is the English name of balanghoy? Kasaba. Scientific name. Ipamemorize na ni Ma'am Hamero o scientific name. What's the scientific name of our balanghoy? Very good. It's Manihot esculenta. Again, that's Manihot esculenta. So, plus points. Okay. Kapag class, hindi mo niluto ng maayos yung balanghoy, marami kasi yun siyang cyanide, especially sa balat niya. So, kapag kinain mo na, you will really have cyanide poisoning. Our problem with cyanide is it can interfere with cellular respiration. So, cellular mismo yung mga cells natin that needs oxygen, mag-i-interfere siya doon. So, mangyayari your cells will be deprived of oxygen. And remember, without oxygen, these cells cannot function well. So this is life-threatening, and syempre, it is considered as a poison. And if the patient class experiences poisoning of this one, you can use the sodium nitrite as an antidote. Okay, so what shall we do to avoid cyanide poisoning? What are we going to do with the balanghoy? Actually, dili lang siya taman sa hugas. You really need to cook that one well. Okay, tarungon dyan mo na siya gluto class ang cassava. Kasi during boiling, cyanide class will evaporate. It will become a gas. And ayun, mawawala na siya doon sa balanghoy itself, and pwede mo na siyang kainin. Okay? Ito, adjud siyang lutuon og tarong, ha? Dili siya maadto sa tubig. It will become a gas. Kapag kalutuin mo siya tarong, cyanide will evaporate. Magiging gas siya. And it will just evaporate gas. Para hindi na siya makita doon sa cassava mismo. And when you eat the cassava, hindi ka na magkaka-cyanide poisoning. Okay? During sa UIC dati, itong 4th year medical, we have a subject called toxicology. Yan yung time na we will learn about poisons and the antidotes for poisons. Now, we have an experiment dati dealing with the cyanide. Kaya lang our problem there was the mishandling of the cyanide by the students, including the teacher, syempre. Meron sa aming time sa UIC, nagka-cyanide poisoning ang buong section. Pero hindi ako kasali doon kasi we have 3 sections during that time. Yung section A namin, dati nag-cyanide poisoning sila, na hospital sila, isa sila ka floor sa hospital sila tanan, ang mga batchmates. During after the experimentation sa cyanide, there was mishandling there. So after ato wala na nag-cyanide handling sa laboratory ang UIC, and we don't do that also sa school. Kasi masyado, syempre poison, masyadong delikado. Kasi madisgrasya sa laboratory, just like during that time, syempre ang UIC nagbayad ato. Daghan kayo sila. As in, isa sila ka-section because of the mishandling. Okay? Ang sa gas, that's still the hydrocyanic acid. Hydrocyanic acid in its gas form during sa heating of the balanghoy, and then it will become a gas. Yeah, it's correct. That is why we don't consume the seed of the apple because it is also rich in cyanide. So if you're going to consume that, that is also a source of cyanide poisoning. Okay? Yeah, ginasala sa tela. Section A. Yeah, section A during that time. Kasi since first year class, section B good ko. Section B, gikan first year hangtod fourth year. Can still remember we have a t-shirt na nakabutang. The best future pharmacist comes from BSPh 3B. Mga baga kay Mignaw. Pahimo may t-shirt ana. Yeah, delikado. Delikado pag makain mo yung seed ng apple kay rich na siya sa cyanide. Pag cyanide poisoning ka na. Baka may reshuffling kasi mahilig ang doctor sa reshuffling of the sections. Yung sa amin kasi sa UIC, hindi kasi siya nag-reshuffle. So classmates kami from first year hanggang fourth year. I don't know if on the second semester we will have a reshuffling of the section or wala. Depende. Pero one thing is sigurado kapag mag-internship na kayo, especially sa Manof sa Manila, dili pwede magkauban ang mga friends, mag-friends. Parehas ana ni Sheila o ni kasi na yung kauban.
Daniela, ma'am. Kambal, ma'am.
Daniela, sige na sila uban. Pagapot ana sa internship, mabulagon gina sila duha. E mas ipakita sa inyong teacher nga sige mong uban kay bulagon jud mong duha. Yeah, mahirap huminga for cyanide poisoning. Kasi there will be a disruption in the cellular respiration. Mas mataas kasi ang affinity ng cyanide class sa red blood cells compared to the oxygen. So, di ba, oxygen is like delivered all over the body through its affinity to hemoglobin in the red blood cells. So, instead of the oxygen, it will be the cyanide. Yeah, makapatay. Patay juga diretso aning cyanide poisoning. And during that time, what happened in the experimentation, kami kasi yung nauna, section B yung sa morning, and then we are given the hydrocyanic acid. We place the hydrocyanic acid in the meat. Bumili kami ng meat nun. Baboy man siguro ang gigamit ato. The meat tissues, the pork. Tapos we distill it. So from the solid one, the solid cyanide, we converted it to the gas through distillation and collected it as a liquid. Yan kasi yung experiment that time. However, what the other section did was instead of using the meat, they used the tissue paper. Nakalagay kasi doon sa sa procedure, use tissues. So like they mistook the tissues, the meat tissues for the tissue paper. So they use tissue paper, nilagay nila doon yung yung cyanide. And at the same time, they increased the amount. Yung nasa procedure, parang 2 grams lang yung nasa procedure. So sa kanila, they used 20 grams. And when the cyanide evaporated, they actually inhaled the gas. So that is the reason why they were poisoned with the cyanide. that time. So isa sila ka section isa sila ka section, isa sila ka floor sa hospital. I can still remember hapon kasi ilahang experiment ato. And then I think yung isang nagrabihan is nagsuka na siya og dugo. Sila tanan ang ilahang panglasa pait. Tapos they were having headache kasi dilated na yung mga blood vessels nila because of the presence of cyanide. Then nagsuka og dugo tong isa. And then after that, like they were diagnosed na nag-cyanide poisoning, ipatawag na sila tanan, and then they were rushed to the hospital. They were really admitted there. Basta after that, I can still remember the next day we prayed for them, and then after that, we visited them in the hospital. Wala'y namatay ha. Wala'y namatay ata. First aid, you really need the oxygen for this, but you really have to go to the hospital and have the antidote. One of the antidotes is the sodium nitrite. Russian carbon dioxide, it has a greater affinity to our red blood cells. Yan, okay? So for cyanide poisoning class, ito yung mga different antidotes. Okay, you need oxygen, but we need the antidotes. We have the amyl nitrite and the sodium nitrite, which are functional antidotes. And then you have there the sodium thiosulfate, which is a chemical antidote. Now, other drugs for cyanide poisoning, another chemical antidote here is the methylene blue. And we have the so-called hydroxocobalamine cyanide kit, which is also a chemical antidote. Now, what's the difference between a functional antidote and a chemical antidote? Si chemical antidote class ganito, it will really act on the poison itself, and it can deactivate the poison, or it can induce metabolism wherein the metabolite produced is less toxic or it's less soluble, or pwede ding it will have a lesser affinity to, example, yung kagaya sa carbon monoxide na it has a greater affinity to the red blood cells compared to the oxygen. Okay? So yan yung chemical antidote. It will really act on the poison, in this case, a cyanide. This sodium thiosulfate, methylene blue, and the cyanide kit will really target the cyanide inside the body, and it will deactivate the poison, or it will reduce the affinity of the poison to its target site, like the red blood cells. That's the chemical antidote. But if you say functional antidote, the functional antidote has nothing to do with the poison. It will not really target the poison, or it will not act on the poison. It will not have an interaction with the poison. So like in this case, the amyl nitrite and the sodium nitrite class has nothing to do with the sodium nitrite. What are we going to do with the functional antidotes? They are the so-called class antagonists, meaning they will bind to certain receptors or substances inside the body, and they will cause like pharmacologic action that is opposite to the effect of the poison. Type ko. Okay, so for example, if the poison class can cause vasoconstriction, you will be giving substance that will act on a different receptor, but it's the reverse. Okay, it's the opposite. It will cause vasodilation. Yan yung functional antidote. Let me give you another example of a functional antidote para mas maintindihan nyo siya. What causes allergy, class? Anong reason bakit may allergy?
Sa food na gina-intake, ma'am.
Okay, what is in the food? Pwede ba,
Chemicals, char.
pwede yan siya hindi food ha. Kasi for me, for example, the cause of my allergy is not actually food. It's the substance, it's the inhaled substance because I have allergic rhinitis. Yes.
Ma'am, I think ang nakadepende sa immune system sa katao.
Okay, yeah. Tapos, what? Nagkakos ng ng allergy. Yeah, immune system mag-react. If you have allergy class, if you are exposed to the allergen, yeah, the allergen. And ito kasi yun. Let me get my pen. I want to write sa screen. Ganahan mag-type ng birthday. Hindi na ko masulatan. Huwag muna ang pen. Sige, dala-dala. Siya mag-react. Nangyari doon. Ayan na. Okay. If you have allergy class, syempre, you will be exposed with the allergen. So, allergen, okay, is any substance that will trigger the allergy. Guys, no. Okay. So, example, sa itlog, we have class, I forgot the name of the protein. I think it's the ovomucoid, but it's the one that causes allergy. It's a protein substance presence in the egg na nagkakos again ng allergy. Ako, allergic rhinitis sa akin, so I have inhalational allergen. Sa shrimp, what is in the shrimps and other seafoods? It's the presence of histamine. Maraming histamine kasi talaga. So class, kapag you have allergen, that will trigger your body to release a lot of histamine. Ito talaga yung substance class na nagkukos ng allergy. It's the histamine. The shrimp, the body of the shrimp, even the crabs itself contain histamine mismo. So when you consume them, you will add up to the histamine that is already found in your body. So kaya notorious yan sila of causing allergy. But it also involves the reaction of your immune system ha, kasi not all people is allergic to like seafoods or like shrimps. Their body is not really that sensitive to the histamine. Okay? So, again, what causes allergy? It's the presence of histamine. So, histamine class will have its own receptor in the body, and we call that H1 or histamine 1 receptor. Now, if this histamine binds to that receptor, it will cause actions or effects in the body, just like yung inflammation, kanang rashes, na katol, urticaria, kana sila are actually inflammation. Yan, kinukos yan siya ni histamine if it binds to the histamine receptor. Now, aside from the inflammation, aside from kanang mga katol-katol imuhang ingon, histamine can also cause bronchoconstriction and decrease in the blood pressure because of the vasodilation. Now these two class is what we call the anaphylactic shock. Are you familiar with this? Anaphylactic shock. Yeah, same thing sa chicken. Hereditary? No. Not really. Hindi siya actually that like yung sa hereditary, hindi siya mostly ganyan. It's really on your immune system. Are you familiar with anaphylactic shock? Yeah, random. Depende sa reaction mo. Anaphylactic shock class is the severe form of allergy. Kasi ang alam nyo about allergy is just yung katol-katol, na ay rashes, na ay magburot-burot sa lawas, makate, o kaya may mag-inflame. Example, like kung allergic ka sa paracetamol, say muburot imuhang lips, kana nga to ang nabalaan sa allergy. Pero when you say anaphylactic shock, severe form ng allergy, ito na yung life-threatening. Marami nang namatay sa anaphylactic shock class. Bakit? Kasi histamine itself can cause bronchoconstriction. Mag-constrict yung bronchioles. What do you mean by bronchioles? It's our airway. Diyan dumadaan yung hangin papunta sa lungs. Now, if it is constricted, syempre, mahihirapan tayong huminga. Okay? Tapos, it will cause sudden drop in the blood pressure. That's what we call shock. Okay? Because of the vasodilation. Kasi pag nag-dilate yung blood vessels natin, lalaki yung daanan ng ating blood. Okay? Therefore, it don't need a lot of force for it to flow. Kaya magda-drop yung BP. Kasi remember, the blood pressure is the force na nag-push sa ating blood to flow. Now, since nag-vasodilation, kaya nagda-drop ang BP. And take note, this is life-threatening. A lot of people already died because nikaon lang sila itlog o kaya nikaon lang sila og chicken. Okay? Sama na. Okay. At sa pag mag-drop ang BP. Yeah, if for example, the patient experiences drop or decrease in the blood pressure, ano yun siya, parang automatic na response ng ating body na ipapabilis yung heart rate. Kasi that is to compensate to what is lacking. Kapag mababa ang BP, paspasan ang heart rate para mabalik siya sa normal. Pero that is not good also if you have palpitation. Okay? Do you have questions sa anaphylactic shock? Wala pa mo kakitag someone nga namatay because of allergy? Ako, I saw someone when I had my duty sa hospital internship. I was a student back then. Nag-hospital internship ako and then night shift ko ato. So my duty was 11 to 7. Tapos pagka 7 o'clock sa buntag, syempre mag-out na ko. Ako ato sa akong time card. Sa bandy clock, mag-out ko. Nakasabay ko og nurse. Nag-in siya. So pambuntag siya ato. 7 to 3 iyahang duty. Na siya sa sulod sa hospital ha. Pero wala na siya nakaabot sa iyahang station. Kasi nag-anaphylactic siya. Parang kumain ata siya ng itlog before siya pumasok sa hospital. As in, bigla na lang nag-atake, hindi na siya makaginhawa. There was a sudden drop sa kanyang blood pressure. Wala, naano siya sa sulod sa hospital, namatay, gihapon siya. No, kanang magburot imuhang mata, imuhang lips, that is not an example of anaphylactic shock. That is just the allergy itself. Anaphylactic shock means bronchoconstriction, mahirapan kang huminga, and then there will be decrease in the blood pressure. Okay? So pag nahirapan ng huminga yung patient natin, anaphylactic shock na yun ha, it's the severe form of allergy compared to yung mga nag-a-allergy na makate, ang whatever. And then compared also to example sa akin, allergic rhinitis, every morning class na jud ko eh. Sleep on. Pati talaga yung ko every morning because of that allergic rhinitis. And I should not be exposed to everything na may malakas na odor Okay, malakas na smell. Kaya ever since talaga yung mga students ko from the first batch, alam yan nila, ayaw dyan mo magpahumot sa akong atubangan or if na ako, kay mag-atake dyan ang akong allergic rhinitis, anak. Okay, pero again, pag nahirapan ng huminga and mag-decrease ng blood pressure, anaphylactic shock na yan, and take note, this is life-threatening. Again, this is life-threatening class. Nakakamatay. Now, ano bang tinitake natin pag may allergy? Yeah, mild allergy attack yan pag rashes, yeah, na inflammation in your body. Antihistamine. Okay, very good. Antihistamine. Example ng antihistamine natin. Yeah, cetirizine.
Glycorchar.
I'm not familiar with brands, ha? I'm not really familiar with brands. Let's talk about the generic names of the drugs. Kasi brands are given by the manufacturer. Okay, just like the paracetamol, we have the Biogesic, yan yung pinakakilalang brand. Pero that is just given by the manufacturer. Ang tag-iya sa drug. Pero when you say generic name, it's the name of the drug itself, but it's actually an abbreviation of the chemical name. The drug class has at least 3 names. The chemical name, that's the true name of the drug, and it will really show us the chemical structure class, a representation of the chemical structure of the drug. And then you have the generic name. The generic name is the abbreviation of the chemical name. And then the number 3 is the brand name, which is given by the manufacturer. So for our antihistamine, we have drugs like cetirizine, and then we have loratadine. Okay, loratadine, ha. Guaifenesin is an expectorant. It's not an antihistamine. Okay, these are examples. Yung sikat lang ha, kasi marami talaga tayong antihistamine in the market. The meclizine is also one. And I believe you don't know what meclizine is, but mas kilala niyo siya as Bonamine. Bonamine is meclizine. Bonamine is a brand name. Its generic name is meclizine, and it's an antihistamine. Yeah, guaifenesin is an expectorant. It's not an antihistamine. So this drugs class will bind to this receptor also. Parang ano siya, competitive inhibitor of the histamine. Okay? Now, if these drugs block the histamine receptor, syempre walang allergy. Okay? Walang allergy. Yeah, taas kayo na ilahang mga chemical name. That is why we don't call them using their chemical names. Let's abbreviate the chemical name, and that is the so-called generic name. Okay? Don't use the chemical name, mabuang tanan. Okay, however, what's the problem with our antihistamines? They don't treat the anaphylactic shock. Okay? Again, antihistamines don't really treat, or they are not really effective if the person class experiences anaphylactic shock. So therefore, we can only use this common antihistamine in the mild forms of allergy. Like if you have like rashes and other katol-katol diha sa imong lawas, allergic rhinitis, you can use also that one. Kani sila cetirizine, loratadine, meclizine, buclizine, daghan na sila kaayo. Okay, ang common lang jud cetirizine and loratadine. And we also have fexofenadine, pero dili ko ni siya common. But most of our antihistamine can cross the blood-brain barrier, therefore it can reach the brain, and that is the reason why it can induce sleep. So yan yung magiging side effect ng ating mga antihistamine. Okay, mag-i-induce yan sila ng sleep except for loratadine and fexofenadine. So do not consume antihistamine if you want to be awake. If you want to be alert, if you want to be awake class, you use loratadine or fexofenadine. Ay mo kalimutan. Di ba pag naglorat imuhang mata, dili mo katulog. So that's loratadine. That's how I remember it. Na ito, among our antihistamine, ito yung hindi nakakatulog. Cetirizine is notorious of being a sedative. So makatulog ka. Masayun. Okay, again. Si antihistamines natin, dito yan sila mag-a-act sa histamine receptor. They will compete with the histamine itself. And pag marami kasi yung kanilang concentration, matatalo nila si histamine. So, hindi na si histamine makakabind sa receptor na yan. And wala na yung mga like signs and symptoms of allergy like the inflammation. But again, except bronchoconstriction and BP, increase in the blood pressure. Therefore, for anaphylactic shock, we only use functional antidotes. Sabi ko kanina, si functional antidote has nothing to do with like the poison itself. In this case, it's the histamine. Sa anaphylactic shock, our drug of choice is the epinephrine. I don't know if you're familiar with epinephrine. It's a hormone inside the body, but we also have a drug preparation for this in the market. Other name for epinephrine is adrenaline. And yes, that's the one that causes adrenaline rush during emergency situation. Okay? Severe allergy, it's not really mas isog na tambal, but this one is a functional antidote. It has nothing to do with histamine. Epinephrine does not bind on histamine receptor. So again, anong ibig sabihin ng functional antidote? It will have its action on the other side. And it has, again, nothing to do, it will not react with the poison, it will not react with the substance causing the allergy, it will not even bind to the receptor ni histamine. Pero, what will the functional antidote do? Counteract the activity of the poison, or in this case, counteract the activity of the histamine. If you give the patient epinephrine, it will bind to its own receptor. You will have this one in your pharmacology. Paunang discussion lang ito. I will not dig deeper on this. But epinephrine will bind to alpha-1 and beta-2 receptors in the body. And pag nag-bind yan siya sa alpha-1 receptor, it will cause vasoconstriction. So in this case, yes, the vasodilation is counteracted, and beta-2, pag beta-2 receptor siya mag-bind, it will cause bronchodilation to help the patient sa kanyang paghinga. So this one is also contraindicated. So take note, ano yung kaibahan nila? Si functional antidote has nothing to do with the histamine, to the poison, to the one that causes that allergy. Pero magkakaroon siya ng effect that will counteract the effect of histamine. That's what you mean by functional antidote. Okay? Yeah, we have epinephrine pen. Epinephrine is not given orally. It is not active orally. It is easily degraded in the body if you take that orally. So we give epinephrine parenterally. It can be intravenous or intramuscular na injection. And yes, we have like epinephrine pen na ina-administer intracardiac, meaning pag intracardiac gani class, it means diretso sa heart. Itutusok sa heart, and kasi ang cause talaga ng epinephrine is to make your heart beat again during emergency situation. But it will also increase your blood pressure through vasoconstriction, and it can dilate your bronchioles para makaginhawa ka. Nga na ang activity ni epinephrine. Okay? So ano yan siya? Functional antidote for anaphylactic shock. That's the severe form of allergy. So as you can see in my illustration, it has nothing to do with histamine. It does not interact with histamine receptor, unlike the antihistamines. pero it's a drug for allergy. Pero for anaphylactic shock lang. So since it's a drug for allergy pero it has nothing to do with histamine, it is called functional antidote. Ay, hindi siya sa lungs itusok. Hindi tayo nagtutusok directly to the lungs. Our lungs is very sensitive. It has a very thin membrane. So we administer epinephrine IM or IV. Not really on the muscles, the pits sa lungs. You can administer that one anywhere sa muscles. But if it is an emergency situation, do not give that intramuscularly kasi it needs to be delivered to the blood first before it can be delivered also or distributed all over the body. If emergency situation class, nag-IV talaga tayo, intravenous injection. Okay? Kasi yung mga drugs natin class, ang target talaga natin, mapunta yung drug sa blood. Kasi it will be the blood that is responsible in distributing the drug all over the body. And pag na-distribute na yan siya sa body natin, naaabot yan siya sa target site. Remember our blood travels class. Kung example, masakit ang ulo mo, uminom ka ng paracetamol, the paracetamol from the gastrointestinal tract should be absorbed in the blood. Kasi si blood yung umaabot dyan sa ulo mo. And pag umabot dyan yung blood with the paracetamol, that's the only time it will take its action. Unless na hindi yan siya mapupunta sa blood mo, hindi yan siya aabot sa target site. Walang effect yung drug. Okay? So for emergency situation, nagdali ta. Alangan na, dili na makaginawa imong patient, ipainom pa nimo siya og tambal. Dugay pa to, natunaw ang tablet, naghulat pa kag kanus siya ma-absorb, maghulat pa kag kanus siya mag-distribute by the blood before siya mag-take of action. So again, for emergency situation, it will always be intravenous injection. It will not be, actually, hindi din siya dapat IM kapag emergency situation kasi nasa muscle yung drug niyan kapag ka-IM. And maghihintay ka pa na matatransfer yung blood from the muscle to the blood vessels and mapunta sa blood. It will take time also. So IV is the best choice if it is an emergency situation. Unless it's not emergency, pwede na yung IM. Example, like sa vaccine, IM natin siya ini-inject, no? Hindi naman yun emergency situation. Okay? Yung iba lang, nag-IM sila kapag may mga emergency situation, nag-IM sila if walang choice, hindi natin makita yung blood vessel. Isubi, magtusok o intravenous, no? Hahanapin mo pa yung blood vessel. So, minsan, ini-inject na lang nila diretso sa muscles. Kasi mas mabilis yun compared sa oral. Yeah, mas mabilis talaga yung IV kasi sa IM kasi sa IV nasa intravenous. IV means intravenous, meaning inject mo yung drug directly to the blood vessel. Nasa blood na siya kaagad. And then since nasa blood na siya kaagad, madidistribute na siya, mas mabilis siyang mapunta sa site or sa target site. Okay? Para mag-take siya ng action doon. Whereas kung sa IM, hintayin mo pa from the muscle, mapunta siya sa blood. So take note ha, except for antacids, yung mga drugs natin, except for topical uses also, kailangan ang drugs mapunta muna sa blood before siya mag-take ng kanyang action. And syempre, since IV is diretso sa blood, yan yung pinakamabilis na route of administration. Okay? And it has 100% bioavailability. When you say 100% bioavailability, or the bioavailability itself, it's the amount of blood that reaches the bloodstream. Okay? So si IV, 100% talaga yan kasi diretso mo nga siyang in-inject. Whereas compared to oral or IM, may mga processes pa kasing ginagawa before ma-transfer yung blood ay yung drug natin sa blood. So during that process nababawasan yung amount. So hindi na siya 100% umaabot doon sa blood natin. Okay? Especially the oral. Yung drug natin minsan nasisira pa yan ng gastric juice, nasisira pa yan ng pancreatic enzymes, or yung portion of the drug will actually go to the liver via the portal, the hepatic portal that connects the intestine and the liver. So pag napunta yung drug sa liver class, na metabolize na yan siya and na-excrete. So nababawasan na naman yung drug na umaabot sa blood. So maraming yan yung pinag-aaralan actually sa pharmacy. It's not just about memorizing the name of the drugs and i-memorize natin kung para saan sila. We have to learn also their activities inside the body, their effect inside the body, and yung effect din ng body doon sa drug. So it's the other way around ha. The effect of drug in the body and then the effect of the body to the drug. Kasi yung body natin has the ability to get rid of the drug and then makukuhanan yung kanyang action. So pharmacy is not really a simple thing as memorizing the name of the drugs class, ha? You have to be ready with that. We even have a subject na nagko-compute tayo kung ilang drugs na lang yung natira sa body. Example, iminom ka ng 500 milligrams na paracetamol. After an hour, gaano na lang karami yung natira. Gaano na karami yung na-excrete. And through that computation also, we can estimate nasaan ng part sa body yung drug natin. Nasa loob na ba siya ng cell or nasa blood pa siya. Ganun, may subject tayo. Yan. Hindi lang yan siya. Hindi lang ito basta-basta pharmacy class. Kahit mo na akong ginaingon sa mga students, ayun, jud magsugot, tawagon mo og tindera. Kay, you know that first year pa lang, we are learning complicated things, marag everything under the sun. Okay? Sige. So I hope you understood what functional antidote is. Functional antidote yan siya. Now, let's move on. Iba yung sodium nitrite sa sodium nitrate, ha? Nitrite is NO2, nitrate is NO3. Nitrite is the salitre, and NO3, the nitrate, is called the chili saltpeter. So, ano yung sodium nitrate? Ginagamit siya as fertilizer. Actually, this is the oldest known fertilizer that we have. But since this also contains nitrate, the nitrogen inside the body, it will also be converted to nitrosamine, and we can use this as a meat preservative also, just like the nitrite. But the nitrite is most commonly used compared to the nitrate, but it's already banned because it is carcinogenic. Now, how do we produce the sodium nitrate? We have the so-called Guggenheim process. It employs ferric chloride, and magkakaroon ng daghang process ni siya sa aeration, filtration, lalagyan ng air yung ferric chloride until mabuo yung sodium nitrate. But nevertheless, the process is called Guggenheim process. We don't do this sa laboratory, ha? It's a complicated process of producing sodium nitrate. Okay, next we have the sodium sulfate. This is Na2SO4, or we call this the Glober salt or the salt mirabile. Para sa atong sodium sulfate, we use this one as a saline laxative. What do you mean by laxative? Pampaunsa ang laxative. Pampadumi, okay. Pampabawas, pampadefecate. Okay? Depende yan siya. madami tayong function. Wait lang. Marami tayong laxative. Different ang functions nila, class ha. May laxative tayo na tinatawag na bulking laxative. Meaning yan, pampadagdag lang talaga, pampadagdag ng stool para madali siyang ma-excrete. Ano ba yung normal na pagbawas? Is it once a day, 2 times a day, every other day? Ano ba yung normal?
Four to 10 times ang nakalagay sa Google lang.
Ha? Ano sa?
4 to 10 times a day.
Oh, grabe sad. Grabe mo ng tentan sa kaapan, kada kaon malibang. Class, wala talaga tayong normal na pagbawas ha kasi it is depende siya kada tao, iba-iba tayo class ng pagbawas. Ang normal talaga class is kapag napuno na yung ating intestine, yan yung time na magbabawas tayo. Ha? It will really send a signal to the brain na puno na, and your brain will really act on it, especially on the motor neurons. Mag-a-act siya doon, signaling also that you need to defecate kasi puno na yung intestine mo. So, ang pagbawas mo, again, is nakadepende kung kailan mapuno yung iyong intestine. Ha? Tapos kapag ka nagbabawas ka, 1/2 lang yung nilalabas mo. Okay, 1/2. So, pag nalabas mo na yung 1/2 ng laman ng intestine mo, maghihintay ka na naman kung kailan siya ulit mapupuno. Okay? That's the normal process. Siyempre, kung marami kang kinain, madaling mapuno yung iyong intestine. Pero depende din yan siya sa size ng intestine mo. Baka din kasi wait lang ha, kaya nagtawag si Lynn. Let's actually ganito. Masarap pa. Depende sa makonsumo na food, and then depende din sa size ng iyong intestine. Siyempre yung mga malalaking tao, malalaki din yung intestine nila. And marami dapat silang kainin before mapuno yung kanilang intestine, before sila mag-defecate. Na yung mga laxative natin, class, may mga laxative tayong bulking agents para mabilis mapuno yung ating intestine and maka-defecate tayo. Okay, meron tayong ganyan, mga bulking agents. Example, yung psyllium. I don't know if you are familiar with psyllium. It's a seed class na pag ininom natin siya, nagbabulk, maraming bulking agent siya. Dadami yung laman ng iyong intestine, madali siyang mapuno. Meron din tayong mga laxative na irritant. When you say irritant, it will cause irritation sa gastrointestinal tract, and then ang mangyayari dyan, bibilis yung peristalsis or yung motility ng ating GIT. And yun yung laxative na masakit sa tiyan. Kasi nai-irritate yung ating intestinal mucosa. Masakit talaga yun siya. Pero because of that, na mabilis yung kanyang peristalsis, mabilis din ang movement, mabilis yung pag-defecate natin. Okay? Meron tayong mga ganyan. Example, yung Senna, yung Senocot, Biggerlay. Biggerlay yung pangalan ng brand ha. Hindi na siya pampapayat, laxative na siya. The BioFit tea, laxative po na siya. It contains Senna also. Yun, masakit yan siya sa tiyan na laxative kasi irritant nga siya. Meron din tayong laxative na pampasoften lang sa stool. Kasi minsan dry masyado yung stool natin, especially if we lack water. Yung mga person na hindi masyadong niinom ng tubig, kaya dry yung kanilang stool, mahirap siya ilabas. So meron tayong ganyan, nagsosoften sa stool. Example, glycerin. Yung glycerin na suppository, nilalagay sa puwet. Ayan, tumultun. Mag-soften yung stool niyan and mabilis siyang malabas. Okay? So again, depende ha sa laxative na kinukonsume natin. Pero you only have the laxative if you have constipation. Kasi kapag palagi kang nagtitake ng laxative, you will develop laxative habit. Hindi ka na makakabawas kapag hindi ka uminom ng laxative, magiging dependent ka doon. So please do not take laxative every time. Okay? Kapag sobra-sobra na yung inyong constipation, that's the time you consume one. Si sodium sulfate is poorly absorbed in the intestinal tract, so it will like a bulking laxative, bulk forming laxative, pampadami ng stool. That's the sodium sulfate. And then we have the sodium tartrate, which is also a saline laxative, but in the laboratory, this is a primary standard for Carl Fisher reagent. Si Carl Fisher reagent is ginagamit natin for water analysis or moisture content determination. Kapag gumawa kasi tayo ng drug class, example, gumawa tayo ng tablet, kasali kasi siya sa testing na dinedetermine natin ang amount ng water doon sa mga powders natin. Please take note, the presence of water, especially if marami, will make the drug prone to bacterial or microbial contamination. Okay? Pag maraming tubig, gusto yan. Gusto yan ng bacteria, gusto yan ng fungi. So, kaya, mini-measure natin yung amount ng water sa mga substances natin para at at a normal level lang siya na hindi talaga siya mag-a-attract ng microbes, ng bacteria o kaya fungi. So si molds is one type of fungi. Sali yan siya sa mga fungi. Si molds. So, yan yung isang reagent na ginagamit natin for moisture content determination, si Carl Fisher reagent. And if you want to standardize, if you want to know the concentration of the Carl Fisher reagent, what we use is the sodium tartrate. Okay, ginagamit natin si sodium tartrate for that. Okay? Next, we have the sodium thiocyanate, which is a hypotensive agent. When you say hypotensive, this can cause decrease in the blood pressure. Okay? Decrease in the blood pressure class. Hindi mo siya move. We call that hypotensive agent. In some case, we can call this also anti-hypertensive agent because it can cause hypotension. Okay? And then we have the sodium thiosulfate, or we call this hypochlor or photographer's hypo. Photographer's hypo kay ginagamit nila ni kanang mag-develop sila og film. Karon man go dili na unso magpa-develop og picture, no? Mag-picture yung nasa padulong sa Facebook. Wala na sa Instagram. Wala na kaayo na nag-develop og picture, no? So sa una kanilang ginagamit sodium thiosulfate, photographer's hypo, para sa pag-develop sa picture. Daghan kay siya other name, but nevertheless, that's sodium thiosulfate. Na na-mention ito kanina, this is a treatment for cyanide poisoning. We can also use this one for iodine toxicity. Actually, iodine class, ay wala pa man ta nakagamit og iodine sa laboratory, no? It is a colored substance. Brown ang color ng iodine. Tapos if you have like interaction with the iodine in your hands or sa imong sinina, nagsustain talaga yan siya. Now, since sodium thiosulfate is used in the management of ion toxicity, it can also remove iodine stain. Okay? Ginagamit din yan siya sa iodometry. Iodometry is a process of determining the concentration of either the reducing agents and oxidizing agents we have in the laboratory through the use of iodine. So kasama din si sodium thiosulfate dyan. So we have oxidizing and reducing agent. We have discussed that one sa prelim. Pag sinabing oxidizing agent, that involves addition of oxygen, and that involves also the increase of the oxidation state or the charge. Example, from +1 magiging +2 siya. Oxidation ang tawag doon. Kapag reduction naman, anong mangyayari sa reduction? Baliktad, there will be removal of oxygen or reduction in the oxidation state from +2, magiging +1 na lang siya. Okay, so yung mga substances involved dyan, we have oxidizing agents and reducing agents. And then the process of determining the concentration of our oxidizing and reducing agent is called iodometry, which uses iodine. And because there is iodine, we also use the sodium thiosulfate. You will encounter this one in the second semester kasi meron kayong QC. Diyan natin yan dine-determine. Nag-a-assay kasi tayo pag mag-QC na kayo class, nag-a-assay kasi yan. When you say assay, you will determine like the amount of the drug, or you will really identify the drug present in a substance. Okay? Next, we have sodium perborate. This is the chemical formula of our sodium perborate, which is used as a mild disinfectant. I think meron ito sa mga disinfectant natin na available ha. And then because of the presence of oxygen, this readily releases oxygen, and this might be the mechanism of action paano nila pinapatay yung bacteria. May mga bacteria tayo class na namamatay in the presence of oxygen. Okay? So kagaya ng bacteria na nagkokos ng tetanus. So si tetanus ha is not caused by taya. Okay? We have the misconception na pag nagtetanus, nasamad sa taya. No. The tetanus class is caused by bacteria. It's caused by the bacteria called Clostridium tetani, which is found sa soil. Nasa lupa yan class, wala na siya sa taya. Wala na siya sa lansang na taya, sa sin na taya, wala na siya dito. Si Clostridium tetani is nasa soil. Pero bakit natetetanus kapag example natusok sa lansang? Kasi si Clostridium tetani class, pag napunta yun siya doon sa sugat mo, pag malalim ang sugat, sa pinakamalalim na part na sugat kasi there is deficiency of oxygen there. Ganahan si Clostridium tetani dito. Kay walay oxygen. Now, mo na siyang reason nga nung ginapadugo. Kasi pagdugo, merong oxygen. Hindi magka-thrive yung Clostridium tetani. And at the same time, we can use hydrogen peroxide. Di ba? Pag magbutang kag hydrogen peroxide, magbula-bula. Kanang magbula-bula din ha is the indication that there is the release of oxygen. Again, ayaw ni Clostridium tetani kasi ng oxygen class. Okay? So pag wala na nimo gipadugo imong imong samad, wala pud nimo gihugasan, ganahan jud kaayo si Clostridium tetani din ha. And that one causes tetanus. Okay? So walay mag-ingon ha nga ang cause sa tetanus kay lansang. Ang cause sa tetanus kay bacteria. Okay? And then, sodium perborate is an alternative treatment for Vincent's stomatitis. What do you mean by stomatitis? It's inflammation of the mouth. Okay? Sa baba niya, inflammation of the mouth, pwedeng may ulceration, pwedeng may swelling, and then, pwede din kasali ang throat ha, basta the mouth. And that may be due to infection. Pwedeng may infection ka sa gums, and you will experience stomatitis. Okay, now I know. Now I know unsa. Okay, do you have questions so far? Or like clarifications? Okay lang, ha? Wala? Wala question? Okay, so let us continue with the sodium borate, or this is what we call borax. We have a preparation of this called Dobel's solution na ginagamit as astringent. Pirminin nyo ni makita ng astringent sa mga products na to, especially cosmetics. What do you mean by astringent? Okay, meaning anong astringent class? Kaya nag-advertise og mga substances, tas nakalagay astringent daw siya. Ito din ng astringent. What? Unsa naman ang astringent? Uban sa inyo nagagamit og astringent, pero unsa nang astringent?
Ma'am, kanang mo tighten sa skin, ma'am.
Yeah, mag-constrict na siya og mga tissues, mag-tighten sa skin, mag-close sa pores. Yan yung gamit ng
Sa oil, ma'am. Sa skin.
Ga-construct sa skin cells, ma'am.
yeah, ng skin cells. Wait lang. Ayun. Okay? So again ha, mag-shrink ng mga body tissues. So kasali na dyan, pag nag-shrink ang body tissues natin, mag-close yung pores. Yan yung gamit ng astringent. So for example, gumamit ka ng, ano ba yung astringent natin? Eskinol, I think is marketed is astringent. So pag nilagay mo yan siya sa mukha mo, magko-constrict lahat. Okay? So liliit ang iyong pores. Master also is used as an astringent. Okay. Yeah. And then this is also used for cleansing. Si sodium borate has an antiseptic activity, especially for throat and nose. But we don't use the sodium borate internally. Meaning sa labas lang talaga ito. We can use that for throat and nose, pero hindi pwedeng mapunta talaga siya sa blood ha, kasi magkakaroon siya ng negative effect. So external lang ito most of the time, like sa mga cosmetic products natin, like sa skin, if we want to shrink the pores, okay, or the tissues, or pwede din siya mag-dry up ng secretion. Okay? But yung mga astringents natin, hindi talaga sila treatment for like pimples or acne. It will just clean the surface, get rid of the oil. Okay? Kasi kapag yung pimples class, the one that causes pimples, yung bacteria na yan, ang gusto kasi talaga oil. Nagtatribe yan sila sa mga oily surfaces. So if your skin is very oily, ganahan jud kay sila dinha. Okay? Ganahan kay sila dinha magpuyo. So ang paglagyan mo siya ng astringent, since magko-close mag-shrink yung tissues, magko-close yung pores, yung cells natin na nagre-release ng oil class, hindi na siya magre-release ng oil. So kaya mag-dry na yung iyong skin. Ang problema na to kung masubraan o dry ha. So, you don't use also too much of this astringent. I-control lang natin yung oil para hindi mag-thrive yung bacteria. Especially the Staphylococcus aureus. Yan yung nagkukos ng pimples. Okay? Sige. And then we have sodium metabisulfate or the sodium bisulfate. sulfate class. So para saan ito? Si sodium metabisulfate, this is, na-mention na ito last time, this is an antioxidant. Water-soluble antioxidant. Ano ang gamit ng antioxidant? Bakit tayo gumagamit niyan? Para saan? Para saan yung mga antioxidant natin? Sabi ko to last time.
Protect sa mga cells, ma'am.
Okay, to prevent oxidation. Kasi during oxidation, there will also be release of free radicals. Oxygen yan siya na -1 ang charge, and ito yung nagkukos ng signs of aging, nagkukos ng different diseases. Okay, so pwede tayong gumamit ng antioxidant to prevent that from happening. And natin mga antioxidant na para magwapa ka, like vitamin E. Meron din para sa immune system, like the vitamin C. Pero yung mga pharmaceutical products natin, class, meron din yan silang antioxidant. Kasi kapag ka nag-oxidize yung ating pharmaceutical products, it means destruction or degradation for that. So, pwede din sila sa mga products. Yung mga cosmetic products natin, meron din yan silang antioxidant para hindi madali masira yung cosmetic products. Okay, so one example of an antioxidant used is the sodium metabisulfate. And then, we have the disodium calcium EDTA. By the way, EDTA means ethylene diamine tetraacetate. Wait. Ethylene diamine. Ethylene diamine space. Tetraacetate. That's the meaning of EDTA. Aside sa ginagamit siya as a stabilizer for silver protein compounds, may mga silver preparations tayo sa market, pampastabilize niyan. Si EDTA is actually used as a chelating agent. When you say chelating agent, taghan kay tag terms, no? Sa isahon dyan natin na. Pag sinabing chelating agent, class, para siyang magnet na idodraw niya yung metals. Magpo-form siya ng complex sa metals. And the metals will be deactivated. Kita mo sa mga medtech sa school na sila'y dala nga tube. Or kung nakapasibisi mo, iba na sila ginabutangan nga tube sa dugo ng mga medtech. Sa high color violet, sa high color red. So, if I'm not mistaken, the color violet class is called the EDTA tube. Meaning yung tube na yan, merong EDTA sa loob. And bakit merong EDTA? Kasi EDTA is chelating agent. Ang isang reason bakit nagka-clot ang dugo natin aside from the presence of platelet is the presence of calcium. Calcium class is needed for blood clotting. And remember, calcium is a metal. So kapag naay EDTA, nawawala yung calcium, kasi nagpo-form siya ng complex dyan, para siyang magnet na kukunin niya yung calcium, mapilit sa iya si calcium class, that's the complex. And hindi na class magkaklat yung dugo. So ginagawa yan ng mga medical technologists pag ang process na gagawin nila sa dugo requires it na hindi siya dapat magklat. Okay, kaya nilalagay nila sa EDTA tube. Yan yung gamit ng EDTA, chelating agent siya. Okay? So like para siyang magnet din. Okay, and then we have sodium monofluorophosphate, which is a component of our toothpaste like the Colgate. So because of the presence of fluorine, not because of the presence of sodium or the phosphate. It's because of the presence of the fluorine, it has become an anti-cryogenic agent, or it is an anti-carry. Okay, anti-carries. So yan yung gamit ni sodium monofluorophosphate. Tingnan nyo yung Colgate na ginagamit nyo. Yan yung bibigay protection sa ating teeth. Okay? And then another compound of our sodium is the sodium saccharin, but this one is an artificial sweetener. Okay? Artificial sweetener lang siya kasi yung sweetener talaga natin, syempre the sucrose, the table sugar. So ito, since this is a chemical substance synthesized in the laboratory, it has become classed an artificial sweetener. However, our problem with the sodium saccharin is we have studies that link this to the formation of tumors, especially in the bladders. But the study class is more on the animals pa ngayon. Hindi pa talaga siya proven sa tao. But nevertheless, since it can cause tumor sa animals, it might also cause tumor sa tao. And then, sodium saccharin is actually very sweet. Actually, it's 300 times sweeter than our table sugar. Okay, it's different from the magic sugar Si magic sugar class, nang ginagamit nila, sample ganahan, mag-inom-inom og juice sa gawas, tas nagagamit sila magic sugar, pinch lang, tamis na kaayo. Lahi pod ng magic sugar. It's actually sodium cyclamate. Okay? But magic sugar is also banned in the Philippines kasi this will cause this is also considered a carcinogenic agent. So kapag may gumagamit ng magic sugar class, it's actually smuggled. Okay? Smuggled yan siya. Hindi kasi siya talaga pwede dito sa Philippines. Okay? It's not cotton candy. Yung cotton candy natin, sugar lang talaga yan siya na pre-process nila. Yung iba talaga gumagamit ng sweetener na sodium saccharin. Si sodium saccharin, ano pa siya? Pwede pa siya sa Philippines kasi hindi pa proven yung kanyang human testing. Pero si magic sugar, hindi talaga siya. Banned talaga ito. Ito yung ginatawag nato as magic sugar. So, una, daghan nagabaligyan ni kanang mga nagabaligya juice, mga Milo-Milo sa gawas sa eskwelahan. Ano sila ang nagagamit pero yan. Kasi makakatipid sila kasi like pinch lang, matamis na yung like juice or yung Milo. Okay? Whereas kung gagamit kasi sila ng asukal talaga class, our table sugar, syempre, number 1, mahal. Tapos number 2, they will be using a lot of that para mapatamis nila ilang ginatimpla. So sila kay nagtipid man sila nang nagagamit sila magic sugar. Pero you have to educate the public that it is considered carcinogenic. Okay? And then test for the presence of saccharin. If we want to test if the product contains saccharin as its sweetener, we call the test fluorescein test kasi adding the reagent to the substance with the sodium saccharin will give us the fluorescent green liquid. It will indicate a positive result, meaning meron talaga yung sodium saccharin. Okay? And then, ibang pagkatam is magical. Yeah. Next, we have the sodium nitroprusside. This one is hypotensive agent. Actually, sodium nitroprusside is our drug of choice for hypertensive crisis. Ano ba ibig sabihin ng hypertensive crisis? Ano yung normal BP natin? Normal blood pressure. Do you know the normal blood pressure?
(110/80). Char.
Ang ba? Wait, what is that? Okay, very good. That's correct. Cyrus. It's less than 120. and it should be less than 80 also. That's the normal blood pressure. So pag ang BP mo is 110/80, hindi yan normal class kasi si 80 ay hindi normal. It should be less than 80. And at the same time, less than 120. Pero wag naman yung umabot na ng 60/40. That's what we call hypotension. And it's life-threatening, syempre. Wala na nag-flow yung dugo, ana. Now, this is the normal ha. Pag more than that, syempre, hypertension. Pero pag sinabing hypertensive crisis class, the BP is more than, how do I write this one here? Ito lang i-type, kaya dili na ko siya masulat. For hypertensive crisis, it's more than or equal to 180/120. Kapag umabot sa ganyan ang BP class, hypertensive crisis na ang tawag dyan, and it's an emergency case. Okay? Kailangan mo talagang dalahin ang patient mo sa hospital kasi masyado nang mataas yung BP na yan. Now, we have preparations of sodium nitroprusside in the hospital. Ginagamit natin ito, DOC, drug of choice. When you see DOC, it means drug of choice. Yan siya for hypertensive crisis. However, our problem with sodium nitroprusside is it's very sensitive to light. So, before giving it to the patient, it has to be freshly prepared and at the same time stored in a container that is protected sa light. Pwede mo siyang ilagay sa amber glass container. Yung brown na bottle glass, we call that amber glass bottle. And meron yan siyang protective na ability against light. Okay, or you might cover the bottle with a carbon paper para hindi siya talagang matatamaan ng light and hindi siya masisira yung sodium nitroprusside. Pero this one class is a very powerful vasodilator. Pag sodium nitroprusside yung ibibigay natin sa patient, talagang magdadilate yung mga blood vessels, and that means there will be a bigger pathway for our blood to flow, and it will not require, syempre, mataas na pressure na to flow, kaya bababa talaga, babagsak yung blood pressure from the more than or equal to 180/120. Our problem with the sodium nitroprusside is this one, the presence of cyanide in the structure of the drug. So we really need to monitor the patient for a possible cyanide poisoning. And that is the reason why we give the sodium nitroprusside slowly. It should be slow drip via IV infusion. Slow drip, number 1, to monitor the blood pressure of the patient kasi baka babagsak masyado na mahimo na po siya hypotension. Okay? Hypotensive na yung patient. I-monitor talaga natin. And at the same time, for cyanide poisoning. Okay? So yan yung ibig sabihin ng hypertensive crisis, ha? Don't want to reach that kind of blood pressure. Prone na yan siya sa stroke or sa aneurysm, puputok na yung blood vessel niyan sa pataas sa pressure. Okay? And then we have sodium ascorbate. We have brand names like Fern-C and Euro-C. That's actually vitamin C. It's just that we make it as like a salt in the form of sodium ascorbate. And we know that inside the body, it will still become vitamin C, and vitamin C is used as an antioxidant. Okay? And especially if you lack vitamin C in the body, magiging supplement ito siya. So, ano ito siya? Anti-scurvy. Ang disease kapag kulang ka ng vitamin C in your body is called scurvy. Okay? So, this is called anti-scorbutic agent. And one sign of having scurvy class is kanang luas. Okay? Luas. Pag daghan kag luas, that's an indication na kulang ka ng vitamin C in the body and you need the supplement. By the way, we call them supplement because they will be our supply from what is lacking in the body. So don't drink supplements if walang lacking sa inyo. Wala ka namang vitamin C deficiency, bakit ka uminom ng vitamin C? Diba? Now, vitamin C can be found sa mga pagkain na kinakain natin. So like sa gulay, maraming vitamin C diyan. Ano mangyayari sa'yo pag sobrang vitamin C? Aside sa kinakain mo, nagtitake ka pa ng vitamin C. Kaya nung pandemic, nag-educate talaga tayo sa mga tao na mag-take lang ng vitamin C if kulang ka. Like hindi mo siya nakukuha sa pagkain mo. Okay? Like hindi balance yung diet. May mga tao kasi talagang hindi kumakain ng gulay, gano'n, hindi balance yung diet nila. So, pwede silang mag-take ng vitamin C. Yung iba during the pandemic, umaabot na ng 1 gram ng vitamin C ang tinitake nila sa isang araw. Mangyayari sa'yo. Plus, yung excess na vitamin C, iihi mo lang yan. Number 1, lugi ka na sa pera mo kasi bumibili ka ng maraming vitamin C, ang ending, iihi lang dahil mo siya kay sobra-sobra na. Number 2, this is very acidic, so it might cause hyperacidity. Or if sobra-sobra na talaga, ulcer. Okay? And number 3, class, pag sobrang vitamin C na talaga ang ni-intake nyo sa body ninyo, this will cause kidney stones. So be careful of the amount of the vitamin C na tinetake ninyo. Okay, para lang ito sa may kulang. Please evaluate your diet. If makuha mo talaga sa diet ninyo, sa kinakain ninyo yung vitamin C na yan. Kasi pag nakuha mo, then there's no need for you to take vitamin C. Okay? Ako, personally, I don't drink vitamin C kasi hindi yan kaya ng tiyan ko. I have hyperacidity. And then number 2, nagda-down yung immune system ko kapag umiinom ako ng vitamin C. It's the other way around for me. Hindi siya nabuboost. Kapag umiinom ako ng vitamin C, ito yung time na nagagrabe akong sipon. So, I'm not into vitamin C talaga. My body reacts differently with the vitamin C. And then, baliktad ang effects sa kuhaan. So, wala akong nag-take. And then, let's end here with the sodium formaldehyde sulfoxylate. Take note ha, kasi this is a board exam question. This is our best antidote for mercury poisoning. Particularly if the poisoning is because of the corrosive sublimate called mercuric chloride, kasi it's positive to HgCl2, mercuric chloride. So remember, mercury is a cumulative poison. It's a cumulative poison class. Pag na-accumulate siya sa body, that's the time it will have negative effects in the body. Ano ba target ng mercury? It's the brain. You will have spongy brain. Magbuslot-buslot na imuhang brain, leading to psychosis. Kita mo kay Mad Hatter sa Alice in Wonderland. Ang pangalan ng mercury poisoning is Mad Hatter's disease. Kay tungod, magbuslot-buslot imong brain, mura kag buang after. Okay? So the best antidote for our mercury poisoning is sodium formaldehyde sulfoxylate. So we'll end here. Do you have questions? Crazy. Or clarification?